Welcome back to the Dunwoody Dialogues, where we talk with interesting people, and we do talk about people, but we typically talk with interesting people that can give you new information, maybe about Dunwoody, maybe about their industry, who knows. We want you to go and check all the people out that we've seen before here at the worldwide headquarters of Discover Dunwoody. Check our feed. We have a playlist right here on YouTube. We've had many, many great people. I am Mark Galvin. I'm your host here at the Dunwoody Dialogues, and I'm so happy to introduce you to our newest friend here at Discover Dunwoody, Dr. Sarah Friend. Do you see what I did there?
That was good.
So I love that. Your married name is Friend. What was your maiden name?
Yes, Cook.
Cook. Mm-hmm. All right. Well, Cook doesn't work as well as Dr. Friend. I love that. It's such a perfect fit.
Yes.
Everybody wants their doctor to be a friend, so I love that.
Yes. My husband was very excited to give me that name.
He was. He likes having a doctor in the family.
Yeah. He's like, if you go to medical school, because we started dating in college, and we get married, then you'll be Dr. Friend. I was like,
wow.
That does sound cool.
It is cool. Well, let's talk about what Dr. Friend is doing. She is a triple board certified medical oncologist. And before we started taping today, I told her, you know what, everybody's kind of heard that, but what does it really mean? What does that mean, triple board certified?
Yeah, it's a great question. So before going into oncology, which is cancer medicine, I started in internal medicine, and that is the first board certification that I have is internal medicine. That's primary care. My father is an internal medicine doctor, and that's sort of what paved the way, my father, my grandfather. And so internal medicine is the first one, and then hematology is blood. So iron deficiency, anemia, blood problems is hematology, and that is paired with oncology, which is more of the cancer and the chemotherapy. So when I went into my fellowship training, it was a combined program where I learned both hematology as well as oncology, and I'm board certified in both of those as well. So wow. Internal medicine, hematology, and oncology. But when you think of cancer, it's mainly oncology.
So whenever we hear about anybody being board certified, that means they have a different specialty that they've been tested and met whatever requirements that was
Correct.
There to be board certified there.
Yes, and so there's different fields in medicine. So some will keep their internal medicine training. Some will say, you know what, I really am only using the oncology thing, so I'll just let that one lapse. So it really depends on what you need for your own career. But there's different board certifications depending on the type of doctor you are and how many certifications you have acquired.
See, I learned something new. I didn't know that. I love that. Well, here's why you wanted to come talk to us today, which we're so glad you did. You founded MyfriendMD after working for 8 years at Emory's Winship Cancer Institute. And for the Cancer Institute, are they only in Decatur here in Atlanta, or do they have a number of locations?
Yeah, that's a great question. Emory, a great institution, has different campuses. And so the oncology campuses that I trained at were both in Decatur as well as here in St. Joe's.
Oh, St. Joe's.
So local.
I love St. Joe's.
Yeah, it's a great place for sure.
And so what do you do? This is interesting. At MyfriendMD, you're a coach. Specifically a coach, not a doctor, even though you are a trained doctor and are triple board certified. I'm so impressed by that. But you're a virtual cancer coach who helps people on education and personalized support. What does that share with us? What does that mean, and why did you start this?
I found when I was at Emory and at all of the other places that I've been that I was always a very good 1-hour doctor and a very bad 10-minute doctor. So with the first visit with most people, you get a whole hour, you get to really go deep, get to know someone, and for subsequent visits, you just have to be more efficient. And I found that I would regularly go over my time limit, and I would have more things to discuss, and I wanted to talk about emotional health and nutrition and exercise and all of the other things that I thought were important, but there wasn't enough time within the time constraints. So I decided to launch MyfriendMD to offer 1 hour personalized sessions to have time to answer all of the questions that you can't fit into a short established patient follow-up, and really to help coach and help people navigate their cancer journeys much as you would help a good friend or a relative that has cancer. You would help them navigate by, hours of phone calls behind the scenes and, well, did you think about this? Well, what about this? What about this? And, well, let's unpack that. What are your concerns and your fears? And, when I decided that I would start this, it just is really exciting because it's me practicing in a way that fits my personality and long-windedness, I guess.
No, this is good. And I've certainly seen this. How many times that I picked up the phone and called a friend that's a doctor, and it was actually I clearly remember this. I'll say, hey, I need your help, and they'll say, I'm giving this advice not as a doctor, but as a friend. And I never understood why. That was like, okay, whatever. But that's part of the thing is that you're not acting as a doctor.
Right.
You're acting as a friend that's giving coaching advice. And so not everybody knows this, but I have two brothers that went through pancreatic cancer. One, we've lost to pancreatic cancer.
Sorry.
And I have another brother who's fighting it now. And when all this started, it would have been very nice to be able to pick up the phone, call somebody and say, hey, I met with an oncologist today. What in the heck? I'm sure this happens. You get the message, you're going through all of this information, you sit down with the oncologist, and your brain is firing on so many things. Like there's so much to manage, you're grappling with this. It's probably great to be able to have a friend that you can call afterwards and say, okay, I have no idea what the oncologist told me. What do I need to know? Well, what do I need to make sure I ask my oncologist next time I'm back in there? Is that
So
common?
true. Yeah, it is, because once you hear the C word, your brain shuts down and you only hear a certain amount of what's being told. So I think a really important way you could use a coaching service would be, get out paper and pencil, and we're going to write down questions together and write
good.
these things down, take them in, make sure they're answered. And if you write down the answers, and if you don't know how to write them down, you could even ask the physician or the, physician's assistant or whoever's in the room with you to say, can you answer these questions for me? And I've had patients ask me to do that in the doctor setting, and I've, filled out their questions for them. So it's not unreasonable to come in with a question list and make sure that you're really prepared. And then you're going to have multiple visits, especially with a diagnosis like that. So you can create the question list after the visit. I mean, before is great, but the questions will change based on what you're told. So if you find out, there's a plan that may involve chemotherapy, your new questions will arise. And even after you start the plan, let's say you do the first cycle of chemotherapy and it was horrible. Well, let's unpack that. Why was it horrible? And it's not always horrible, but I'm just saying in general, it's really important to have open dialogue with your medical team. And that's where I will just help with the communication, just helping you to be clear as to exactly, what your questions are, your fears, your concerns. And I do work closely with medical teams in this capacity. So it's not, it's not like I'm trying to pull patients away from their doctors. No, I want us all to work together in this way.
Right.
So you actually are going to feel, really well taken care of. And so that would be the goal. But you're right. Your brain shuts down when you're told you have cancer.
I can imagine. Right? That's
Yeah.
got to be stressful.
Very.
And it just, I'm trying to imagine those stressful situations that we all have been through in our lives. How do we react? And it's probably that times 2 or 3 or 4.
For sure.
That's got to be difficult. Well, you just said something I think is interesting. If one of the folks that you're coaching wanted you to talk to the doctor, can you talk directly to the
Sure.
doctor even?
Yeah, I mean, if they would like me to, I've had doctors who have reached out to me about, mutual people that we've shared in common, and through MyfriendMD as well, and they've encouraged us to all communicate, which I'm happy to do, and I think that serves serves the clients better. So yeah, absolutely, I'd be
That's
happy
great.
to do that. Yeah.
Do doctors sometimes tell their patients that they should talk to you? Or it's somehow a connection with the doctor says, regrettably, and I can see this, that they don't have enough time to answer all those questions, and maybe they could, there's someone who can be a coach for you, who can kind of coach you through some of this. Are you seeing referrals coming from doctors?
Yeah, I think there's a lot of people that want second opinions, or they want to make sure that they're getting a plan that's right for them. So they may know me, personally or through this business and say, you know what, I want to reach out. I have somebody who may be a good fit for this service. And then, we sort of walk through the recommendations made by the doctor and why that was the right recommendation, or why that recommendation was made. And we sort of unpacked it and talk about the fears that go along with it. And then with, the client's permission, I communicate back with the doctor, and I think it sort of is win-win, because it allows me and the client to discuss the diagnosis and their, treatment plan that was made by their treating physician, and then we all work together as a team. And exactly, I have time to answer questions 7 through 30, whereas in a traditional 15, 20, 30-minute visit, you might have time for 4.
Wow.
And again, a lot of people are efficient and may get to all 20 or 30, but I still think if you have a lot of questions, it does help to have that additional time and support to really unpack what's going on.
Yeah, I can see one question, there may be 20 questions, but the first question, I may have another 5 just off
From
of
that. Yeah.
Sure.
And you'll think of them after the visit too. So maybe
100%. That always happens to me every time. I know,
Yeah.
regular doctor is, I forgot to ask
Yeah.
about this.
I mean, your doctor may go through everything you talked about, but then as soon as you leave, your mind thinks of all the other things you need to ask.
Sure.
And so that's a great opportunity to book a session to talk through those other questions.
You said this, and I think that all of us at one time had thought about this, that we should write down our questions when we go see a doctor.
You should.
Is that a good idea? You
Yeah,
encourage that?
you should. And it's important, because there's a lot of big words, a lot of medical terminology, and things that we may be explaining on the doctor side that are to us pretty rote and routine. And
Right.
oh yeah, you're just gonna do 3 months of chemo, but like, what does that mean? Like, can I work? Is there, am I gonna lose my hair? What do you mean? I mean, just how am I gonna feel? There's just so much that goes into a very seemingly simple recommendation. So I think that writing questions down is really important, and it also gives you the ability to talk to other people than just the doctor. So you may be getting an opportunity to meet with a nurse navigator, or a nurse or a pharmacist or a nutritionist. And, there may be other people who can answer some of those questions, but it's really important to write down those questions, because if you don't ask in the moment, you absolutely could forget to ask and then have it
So
go
interesting.
unanswered.
Yeah, I mean, it seems like a basic, but just to have you reconfirm that, I think is great. And you are right. There are words that a lot of doctors use day in and day out that are rote. Like, I have heard people being board certified. What did that really, really mean, right?
Yeah.
And asking those kinds of questions, having somebody who can say, you can come back and say, okay, they said this. Like you just said something I think is an interesting point to ask. When people have chemo, do they always lose their hair?
No.
Wow. See, I always thought that was a thing.
Yeah. And then I think the other question is, what is chemo? So we're moving in a world of targeted therapy, where there's a lot of medicines that you can get IV that are not classified as chemo. So there are some chemos.
But they do the same thing as chemo?
Well, they treat cancer. So
Okay.
if people say the word chemo, they might think that means an IV medication that treats cancer, because they might assume if I'm on chemo, I'm in the infusion chair receiving an IV medication that's treating my cancer.
Sure.
But the word chemo is a specific class of medicine that is not targeted therapy. And in the world of targeted therapy, we have treatments that can be used to target the specific subtype of cancer that can be used with chemo. And can be both pills or IV. So the world of oncology has just gotten so confusing, but the gist of it is that we are moving away from some of the well-known side effects like nausea, vomiting, even hair loss to, at least in some cancers, not losing hair. And we also have new technology, things like cold caps, which Emory has, where you can wear a device on your head to try to reduce the risk of losing your hair.
So it's a cold.
Yeah, it keeps your hair deep frozen through the treatment to
Wow.
reduce the risk of hair loss.
Well, that's great.
Yeah. It's expensive though. It's frustrating. It's about $300 a session and it's cash pay outside. Yeah. So that's annoying, but it could protect you from, from losing your hair, which might be something that is important for you.
Somebody. Yeah.
Exactly.
I think
I'm a
great.
fan for sure.
One of the things that you seem to be focused on, we've talked about this a couple of times, is that there are worries and challenges about breast cancer. And breast cancer patients come to you frequently. What are those common worries that breast cancer patients have, besides some of the things we've already talked about?
I think the fear of recurrence is a very real fear. I think the fear of dying. I think the fear of losing hair. The fear of losing control. There's a lot of people have families and a lot of responsibilities. They might be afraid that they might lose their job, depending on the burden of the disease and what it will take on their ability to work, whether it be time away for treatments or whether it be because of just the way they'll feel and are they able to work despite having chemo brain. So in the very, very beginning, you don't know how the path is going to unfold. And so all the what ifs are still very real. So I think the uncertainty is almost worse than the diagnosis itself. It's not knowing.
I totally get that.
Yeah, it's
I
not
really
knowing.
Get that. Yeah.
Yeah. So I think that and people's situations may change with time as they've, gotten more comfortable with the diagnosis and the treatment plan. But I think in the beginning, especially, there's just a lot of what ifs, and your mind just it just travels.
Sure.
And yeah.
And I can see that, right? Driving, I love to drive to work without any sound or music or anything, because my brain I like to see where it takes me.
Yeah.
And if you have a lot of time to think about a cancer diagnosis, I'm sure that there are plenty of questions. And how, what a luxury to be able to pick up the phone and call someone who is trained in that space.
Totally.
And say, I need somebody to coach me through some of these things. These are the questions that my brain is serving up at 3 a.m. at night. I woke up and I can't sleep. I bet that happens a lot.
A lot.
To have someone that can answer some of those questions. What should I expect tomorrow? I'm going in for my first treatment. And to be able to have somebody that can at least answer those questions, I think that's great. Now, is it true, I've heard this recently, literally within the last week, that breast cancer deaths are dropping? So there's fewer and fewer people dying from breast cancer. Is that true?
Yeah, that's an example of a cancer type that we've made great strides in. So for stage 1, 2, and 3, all three of those stages are curable, and they're curable.
Wow.
Yeah.
Wow.
Not everyone, unfortunately, is cured, and so fear of recurrence is a real reality for a lot of patients who go through the journey. However, they are very curable, and we just get more and more and more improvements and advancements.
That's terrific.
Yeah, so in breast cancer, it gets a lot of the research money. We all know October is Breast Cancer Awareness Month. We don't all know when the other months are for the other cancer types. So anytime you buy the pink flavor of water or you support a fundraiser for breast cancer, you're really giving to a disease that has made tremendous strides, a lot of which is because of this research money. So
I'm sure.
Please keep doing that, because
that's fantastic.
Yeah, a lot of advocates have made really, really important strides.
I think that's great.
Mm-hmm.
So I think this is a novel idea. It seems like a very simple idea. I hate to say it that way.
It's true.
I was like, why isn't this already there? But this seems like it could be a novel approach to cancer care in the future. Do you think that and you've done a lot of studying on this. You've thought about it a lot. Do you think this is something that could become a common cancer care option for people moving forward?
Yeah, I think that getting a sort of masterclass in a disease that you or a loved one has from the expert is something I would certainly want if I was going through that.
A master class.
Yeah, so a master class, you get a whole hour with the expert in the topic that you want to discuss. So for me, as someone that has been trained and, is expert in breast cancer, I have lots of different teachings on various topics within the breast cancer, genre, but it would be really cool if in the future this idea takes off and we can bring in experts in different types of cancer. So colon cancer, lung cancer, lymphoma.
Pancreatic cancer. Yeah.
Exactly. And while any oncologist that has, treated pancreas cancer might feel comfortable, discussing that, I think it would be really great if you could get a bunch of experts to offer a service and offer their time to, to give their time in this way. I think it would be great.
I love this. And the important thing, and we've talked about this, is that you're a coach. You're not serving as a doctor, but you have all the experience that you bring to the table to help answer those questions, to maybe dissuade concerns, even say, okay, these are the areas that you need to be, here's where you need to be concerned.
Totally.
Right? All these things, really not where you should spend your time. This is where you should focus, whatever that may be. Mm-hmm. And then, hey, make sure you consider, all right, if you're worried about losing your hair, ask about the cold
caps.
Cap.
Yeah.
That is great. And you could walk in and say, I'm on a cold cap. Okay, great. How did you hear about this? My coach told me. That is
For
really
sure.
cool.
Yeah.
And literally cool and very, figuratively cool. I think this is brilliant. I've heard a lot about concierge medical practices coming up and becoming popular, but I could see this as becoming a thing where being able to just have a conversation with a doctor, but serving as a coach instead of, I'm not giving you medical opinions. I'm helping you. Basically, we have a problem today. There is a doctor out there that people lean on, and that doctor is Dr. Google. And Dr. Google
true.
can give you bad information. And being able to get advice not from Dr. Google, but from a doctor as a coach, I think that's brilliant.
Thank you. And you're right about that. Regularly, people will come in and have Googled. Someone I know recently was told they have mono, and that's the EBV virus, and immediately Googled, and it's like life-threatening. And I mean, she was extremely upset, and most of the time EBV is not associated with a life-threatening illness, but that's the first thing that came up. So you do have to be careful with Dr. Google. You're exactly right.
Yeah, and to be able to pick up the phone and call someone and say, give me your advice about this.
For sure.
I think is brilliant. Well, we're out of time, and when I hate that. And for the record, I'm very long-winded also, so you and I could sit and talk about this for a long time. And I'm having a thought, just totally extemporaneously, that if our audience asked a question, and maybe we end up with a series 5 questions is typically what I like to do. You live in Dunwoody, you're close?
I do,
okay.
Yeah.
Maybe, what if we had 10 questions that came in about cancer? Would you be willing to come in and answer those questions?
Oh, for sure. Yeah, that sounds fun.
Coach us through that. All right.
I'd love it.
I'm going to keep you on the hotline.
Okay, good.
And maybe we have you come back and answer questions, real questions from our audience. So if you have a question, anything. Now, does it have to be just about one specific kind of cancer? It can be anything.
Anything.
All right. You have a question about it that you're just wondering, or if you need assistance, first of all, you can absolutely call Dr. Friend. And actually, we know her really well, so she's Dr. Sarah to us. But you should definitely go check out your website. Where can people find you?
So, myfriendmd.com. And I'm also on Instagram and TikTok at SarahFriendMD. And that's with an H.
And we will put that in the show notes. But If you want to ask a question, just general question that you'd like for us to ask, we will reach out to Dr. Sarah and say, hey, come on back. We've got about 5 or so questions that we'd love to throw at you. And we'll just sit down and banter about those questions.
That sounds great. I love it.
I know that with watching the things that my brothers have gone through, there are so many questions and there's so many things that are daunting. And in fact, I went with one of my brothers and went to a chemotherapy session and sat in the room
Yes.
and did all that. And it is, yeah, I had no idea what I was walking into
Exactly.
that day. And it wasn't bad. It really wasn't. It was actually kind of boring. But all that said, to know to know that there's someone out there that can answer these questions, I think that's I think it's fantastic. So I appreciate what you're doing, and I hope you're
Thank you.
wildly successful.
Thank you.
That would be good.
Thank you.
Well, so we're going to invite you back. So stay tuned. We'll
Awesome.
let you know. So I'm not going to say entirely goodbye.
Okay.
But we do appreciate you coming and visiting with us today.
Awesome. This was such a pleasure. So thank you guys.
And for all of you, we love, and that's perfect. Thank you. Yes. Thank you for watching today. We love that you're tuning in. You see, these are the types of things we like to talk about here on the Dunwoody Dialogues, always trying to answer questions that are really poignant, that all of us want to have answered. Our show is produced by Discover Dunwoody, and our producer is Madison Holtz. She does great work. She's back there behind the camera switching and making sure we have great sound, so we do appreciate everything she does. As many of you know, we are the producers of the Dunwoody sticker, the Dun sticker. These are free. So if you have somebody trying to get you to buy them from them, no. Just let us know. We will get you a free sticker. They're at the library. They're at City Hall. NFA Burger has them. And any of you out there, if you would like a stack to hand out to your clients, your customers, come let us know. But if you want one and you can't find one, come here to our headquarters, and we're right in the middle of the perimeter. You can find our address on the website. We'd love to give you a Dunwoody sticker. By the way, we also give them out at Lemonade Days. We give them out at the 4th of July Parade. All those spots, just look for us. So on behalf of the entire Discover Dunwoody team, thank you so much for watching. Follow us on our social media channels at Discover Dunwoody and our website, discoverdunwoody.com. If you have an event you want to have listed on our website, go to discoverdunwoody.com. You can list it there yourself. Or if you're looking for something that's going on in Dunwoody, go to discoverdunwoody.com events, and you'll find all the things that are happening here in Dunwoody. We have almost 60 events listed over the next 30 days, so there's plenty there for you to find what to do in your spare time. Well, once again, Dr. Sarah, thank you so much for being here. We appreciate you a lot. And for all of you, thank you for watching. Now, come Discover Dunwoody.